Welcome to the Unwinding Issue Spotting Guide. When states resume Medicaid redeterminations during the unwinding, they should use recent and reliable information to determine an enrollee's eligibility. If that cannot be done, then the state will send a renewal packet to the enrollee, and the state will request enrollees to return the requested data by or before the deadline. Enrollees who don't complete and return the renewal packet will receive a termination notice. Let's take a look at some of the barriers that individuals might face that can lead to loss of Medicaid.
Hi, I'm Erin. I'm 37 and I'm a single mom. My two kids, Jack and Emma, use Medicaid. I try my best for my kids, but honestly, the last 3 years have been really hard for us. I lost my job at a call center when I didn't have childcare during the pandemic shutdown. We lost our apartment and we had to move in with relatives for a while. But we just got moved into subsidized housing last month. When I took my daughter in for the checkup that she needs to enroll in kindergarten, I was told that her Medicaid had been terminated. I am also really worried because my son has developmental delays. He still needs intensive speech therapy. I called the Medicaid worker office and the person I talked to said that I never returned my redetermination packet and my kid's Medicaid was canceled a month ago. I haven't gotten any mail about my Medicaid in several years. Apparently it was mailed to my old apartment address. So now I guess I need to take off work and go to the Medicaid office and reapply all over again. I will probably have to wait all day for someone to meet with me.
For many enrollees, like Erin, it has been several years since they've had to complete a redetermination review. Their contact information might have changed. If a renewal packet, a request for additional information, or even a termination notice is sent to an old address, enrollees might never get this information. This could result in a procedural termination and persons who might still be eligible for Medicaid might lose coverage. It should also be noted that enrollees should not be required to come into an office to submit renewal information. They should be able to submit eligibility data using the same modes available for submitting an application. Multiple modalities for submitting renewal information should include online, by telephone, and by mail. Let's take a look at another example of how issues can occur during unwinding.
Hi, my name is James. I'm 61 and I have a number of chronic health problems. I applied for Social Security disability, but my application was denied. I filed an appeal and the process has dragged on for months. Luckily, Medicaid has been paying for my doctor's visits and prescriptions. I have surgery scheduled in a few weeks. But I've just received a notice that says that my Medicaid will end at the end of the month because I'm over income. I don't know how that could be. I lost my job more than a year ago when I had COVID, and my only income is unemployment benefits. My unemployment is less than half what I made when I was working. I called the Medicaid call center to try to get more information, but I was placed on hold several times and then the call was dropped. I really need Medicaid, but I don't know who to contact.
Federal regulations provide specific requirements about what should be in a proper Medicaid notice. Notices should feature plain and accessible language, relevant dates, clear statement of specific reasons supporting the state's decision, specific regulations that support the action. These regulations cannot just be chapters of Medicaid eligibility regulations. Unfortunately, some states will send notices that do not meet that criteria. Examples of this include notices that have insufficient or wrong information.
I'm Ashley and I'm 21. I've had Medicaid since I was a kid. I never had to think about it. I think my mom did the paperwork. Anyway, last year, I finally moved away from home. My mom gave me my Medicaid card so that I can get my asthma meds. A few months ago, I used my Medicaid card when I had to go to the emergency room. Just last week, I got this letter that says I am no longer eligible because I am now 21. I don't know what to do next. Why did my Medicaid stop? What am I supposed to do about my appointments and medication costs? Maybe I should appeal, but that sounds like something you'd need a lawyer to do. I can't afford a lawyer.
During the unwinding, many enrollees will receive notices about their Medicaid eligibility that are unfamiliar. Some might never have had to navigate annual renewals and the redetermination process before. For example, individuals who received Medicaid as children but who age out of children's Medicaid will need to be evaluated for Medicaid eligibility as adults. States might now require information about their income. In some states, particularly states that have not expanded Medicaid, many young adults will lose access to Medicaid, and they will need to explore other options to access healthcare.
رضا بیا کمکم کن فهمیدنش سخته.
Hi, I'm Reza, and I just want to help my mom. My mom immigrated to the US and she speaks very little English. When I took her to the Department of Social Services and helped her to apply for Medicaid several years ago, I told them that mom only speaks Farsi. But all of the letters that they send her are in English, so my mom saves the letters until I can come over and sort them. Today, I learned that the Medicaid agency told mom to verify her income information by the end of the month. The deadline has passed. Did mom lose Medicaid? Why does she even need to verify her income? She gets a small pension that has not changed since she first applied. And why do they continue to send her letters in a language that she cannot read?
States are required to ensure that enrollees with limited English proficiency have language access in Medicaid programs during the unwinding. States must identify those who need language services. The state must also provide translated notices, qualified bilingual staff or qualified interpreters, or other language services. Failure to provide adequate language access constitutes discrimination against people with limited English proficiency. States are similarly required to provide reasonable accommodations for persons with disabilities. Medicaid agencies should have physically accessible facilities. Staff should be properly trained to assist persons that are hard of hearing or who have cognitive or other disabilities. And processes and procedures should be evaluated to ensure that the Medicaid program does not discriminate against people with disabilities. Thank you again for watching our case-by-case scenarios. Please ask questions if necessary.